Coming up on Primetime Lawmakers, behind-the-scenes work continues on the constitutional amendment to allow state charter schools as a compromise is reached. A controversial measure allowing guns to be carried on college campuses and other currently restricted areas is introduced today. Second Amendment advocates and law enforcement are at odds over this one. Senators invoke the name and legacy of former Governor Zell Miller as discussion about the future of the Hope Scholarship gets heated. Spurred on by last year's execution of Troy Davis, activists and legislators call for an end to the death penalty in Georgia. And the state plans to eliminate bariatric weight loss surgery coverage from the state health benefit plan for an estimated savings of $3.5 million. I'll be joined on set by David Cook, Commissioner of the Department of Community Health, and Representative Katie Dempsey, Vice Chairman, House Appropriations for Human Services. For Thursday, February 16, 2012, the 20th legislative day of the Georgia General Assembly, this is Primetime Lawmakers. Good evening and welcome to Primetime Lawmakers, GPB's nightly coverage of the Georgia General Assembly. I'm Scott Slade. Let's go live to the Capitol, where Sandra Parrish reports a compromise has been reached on charter school legislation.
Scott, both sides have come together and agreed to amend the constitutional amendment and to include language proposed by the Democratic caucus. A separate resolution sponsored by Representative Scott Holcomb has now been incorporated into the measure, creating a category for state-approved charter schools and makes it clear that the state will fund them.
If they want to get something passed, something had to move. And I think if they were just to bring it up the same way without any changes, without listening to what are significant concerns, and they're not only significant concerns to some of us in the metro area, which my district is in Atlanta, but in the rural areas, because people want to make sure that the state funding for those rural schools does not go down. And that's an important question.
All along, those of us who authored the original bill were trying to allay the concerns, the very legitimate concerns that members of the Democratic caucus had, and with lots of hard work and lots of compromise, I believe that we've come to something that we can agree on, that number one, protects the schools that we already have in existence, but also ensures that the state can create charter schools and that the state, in fact, has a role in creating policy.
The House Education Committee was expected to vote on the amended resolution this afternoon, but Chairman Brooks Coleman says it wasn't quite ready. Holcomb says it's possible the measure could make it back to the House floor as soon as tomorrow, but more than likely the vote would come next week. A bill that would greatly expand where guns could be carried in Georgia has been filed in the House. Representative Sean Jurgensen is co-sponsor on the bill.
And it would allow them to carry their firearms in public places and private places as long as that private property owner does not prohibit it.
Under the bill, anyone with a Georgia weapons carry license could take their guns virtually anywhere.
Churches, which of course are private property, so they would make that decision for themselves. Bars, places, public buildings such as county facilities or state facilities, as well as airports, college campuses, things of that nature.
Guns in those public places, though, would have to be concealed. He says they still would not be allowed in certain secured areas.
Federal facilities, courthouses, jails, and prisons. Those would be the off-limit places and private property where the private property owners do not want them to be carried.
In the House today, it nearly passes a measure that would change the qualifications for the state's assistant adjutant general. Currently, that person must have served in the Georgia National Guard for 5 years. Governor Nathan Deal has already appointed retired Lieutenant Colonel Joe Girard, who served 20 years in the U.S. Army, including combat duty in Iraq, but spent no time in the Guard.
Change maintains that the assistant adjutant general must have attained the rank of lieutenant colonel or higher, and removes the requirement of 5 years of continuous service in the National Guard. Also, if the candidate for the Assistant Adjutant General is retired within a 5-year window of the appointment, then the qualifications additionally allow for active service in the Army or Air Force as qualifiers. This bill broadens the pool of potential candidates for the Assistant Adjutant General to ensure that our Georgia National Guard is prepared for active duty when called upon by our governor or the Department of Defense.
This is wrong. It is a very, very wrong act. If you are a lieutenant colonel, you have 2 ranks to go to become a general. There are people in the National Guard that are serving today that have served in combat, that are in charge of our people's lives in this state, that will be mobilized. A lieutenant colonel is a battalion commander or less. But I am a veteran, and I feel like that this is a wrong act. And I think any veteran in here would think that.
The bill passed by just one vote. Representative Sims immediately asked that it be reconsidered tomorrow. The House unanimously adopts a resolution urging Congress to pass a bill to allow cell phone jammers in prisons. Representative Mike Chokas says more than 8,000 phones have been confiscated from prisoners in Georgia, with charges levied against 300 visitors and 60 staff members who smuggled them.
The problem is the illegal use of cell phones is being used to conduct criminal activity in our prisons and outside of our prisons. They're used to coordinate attacks on our prison guards. They're used to promote, coordinate attacks outside the prison. Gang members and organized crime members are using these cell phones to stay in touch with their members outside the state prison and using this to continue their illegal criminal activities.
A 1934 telecommunications law currently prevents use of such devices. Chokas plans to send the resolution to Georgia's congressional delegation and hopes they will come up with some federal legislation. Scott?
Sandra, I've heard from corrections officials, sheriffs, everyone else, if they could get one thing, they could get cell phones out of the hands, or at least inoperative in the hands of inmates. They say they cause more trouble than just about anything else. I'm sure you've heard the same kind of thing.
That's right, especially Fulton County, where we've seen them most recently.
Thanks very much. Georgia garnered national attention last year with the controversial execution of Troy Davis. Davis was convicted of the 1989 murder of Mark McPhail, an off-duty Savannah police officer. After 22 years on death row, Davis was executed despite 7 witnesses recanting their testimony. Today, a group of human rights and religious leaders held a press conference to present legislation that seeks to abolish the death penalty in Georgia, calling the system inherently flawed. One bill would add a provision requiring indisputable physical evidence for prosecutors to seek the death penalty. Primetime Lawmakers' Kelly Murray has more.
In the wake of the execution of Troy Davis last September, religious and human rights groups are now urging lawmakers to abolish the death penalty in Georgia. Today, Georgians for Alternatives to the Death Penalty called on lawmakers to address what they see as threats to fairness and due process in the state's capital punishment system.
We're here during the General Assembly to educate our lawmakers about why we can live without the death penalty in Georgia.
One of the bills that we have is Senate Bill 442. Which says that you cannot seek the death penalty if there's only eyewitness testimony available.
So we stand here strong against the death penalty, declaring it as nothing less than state-sponsored murder.
Yes.
Other bills urge Georgia's district attorneys to invest resources in solving homicides and violence prevention instead of seeking the death penalty.
There's a new wind blowing in Georgia. The execution of Troy Davis has sent out a clarion call across this state and across our nation that we should move into the 21st century.
2 pieces of legislation sponsored by Representative Rich Golick seek to provide dedicated funding for Georgia's public defender system. Supporters of the bills hope that those will go to vote next week. For Primetime Lawmakers, I'm Kelly Murray.
Now back down to the Capitol, where Keosha Howard says things are beginning to heat up in the Senate. Keosha.
Scott, the hot topic in the Senate today, the Hope Scholarship. Senate Democrats and Republicans have been at odds over how to save the struggling scholarship program. Democrats propose an income cap, but Republicans are against the idea. Things got heated, and it all started with the showing of this clip from then Governor Zell Miller introducing Hope in 1992.
This is Georgia's opportunity to pioneer the most far-reaching scholarship program in the nation. And not only for those who are minorities or who come from lower-income families, but also those middle-income families who are devastated with the cost of education and training.
Senator Jason Carter took a point of personal privilege, saying that ex-Governor Miller's dream for hope will not be realized under the current plan.
We will turn back the clock on the exact issues that you just heard Zell Miller speak about when he introduced the Hope Scholarship, the need for an educated workforce, the need to ensure that the middle class and the hardworking students from the middle class can afford and access to higher education. The Hope Scholarship, put simply, is not a patient that has been stabilized. It is a patient that is dying a painful death, and the The other leadership of this state today says we should stand aside and watch. The Democratic plan to provide hope for those hardworking middle-class students is less expensive than the governor's plan.
Governor Miller said this would be the most all-inclusive scholarship program anywhere in the country. He said that it would be that we needed a better educated workforce is our number one thing to help our economy. He said that it was not only for low income, not only for middle income, but those were his words, all inclusive. Governor Miller presided over the expansion of this program. The expansion when we started it out limited and we expanded it to everyone. He presided over that expansion. It made this situation inevitable. It was inevitable from the day we started in the lottery business and put this program in place that we would face a day where we had to make choices. Why? Because the cost of higher education is escalating in this country at an incomprehensible rate, and disposable income for those who buy lottery tickets or anything else is not accelerating at the same rate.
And you just heard from Senators Jason Carter and Senator Charlie Bethel. Last year, the Hope Scholarship was changed, splitting recipients into two categories: Zell Miller scholars who receive full tuition to any college in Georgia, and Hope scholars who receive 90% of their tuition. Democrats from the House and Senate joined forces today to present companion legislation that would create an insurance marketplace in the state where individuals and small businesses would have more health care options. Senator Nan Orrock and Representative Pat Gardner say health care exchange is necessary to promote competition.
Insurance companies will compete to provide the best product at the best price. And tough rules will make sure that every insurance package covers the basics, like annual checkups and preventive medicine. The competitive healthcare marketplace brings real competition and greater transparency to the insurance industry, and that's going to work to bring down consumer costs.
Regardless of the challenge to the Affordable Care Act that's going on in Washington, this marketplace is needed in Georgia now. If no bill passes this session and the Affordable Care Act is upheld, only states with bills in place regarding it setting up a health insurance exchange will be able to receive federal fundings to set up the exchange.
Talk of starting a healthcare marketplace also came up last year, and Governor Nathan Deal was behind it. With the Supreme Court expected to rule on the constitutionality of the federal healthcare legislation, Governor Nathan Deal now says, quote, he doesn't want to move forward before the court rules because if Obamacare is tossed, there will be no exchange. Also under the Gold Dome today, the Senate passed 3 pieces of legislation, including a housekeeping measure that would authorize insurers to issue closing letters in real estate transactions. Senator David Schaefer explains.
A closing protection letter is a letter that is written by a title insurance company to a lender, essentially guaranteeing that the closing attorney will disperse the funds from the loan closing properly. The insurance department has found that the issuance of this letter is in fact the issuance of an insurance product, and that the current definition of a title insurance company's powers does not include the issuance of these closing protection letters. This legislation simply clarifies that a title insurance company can issue the letters that they're already issuing, and also makes clear that they can't charge anything for those letters unless that amount is approved by the insurance department.
That measure passed and now goes to the House. Scott also passing the Senate a bill that makes it a felony to bring contraband into a youth detention center.
Thanks very much, Kiosha. A rainy afternoon still drew a substantial crowd to the Capitol steps for a rally hosted by the Georgia Council on Developmental Disabilities. The annual Disability Day at the Capitol seeks to promote access, opportunity, and meaningful community living for Georgians with disabilities and their families. Governor Nathan Deal addressed the gathering, and Reverend Dr. Gerald R. Durley honored fallen soldiers. The council hopes to pass state individual development account legislation that enables individuals with disabilities to save toward an accessible vehicle and communications devices. Furthermore, they declared their support for the passage of the Family Care Act, which allows workers with paid sick leave to use it to care for their sick children or aging parents. That bill is currently in the House Industrial Relations Committee. Coming up after the break, tough budget times bring tough budget cuts. Just ahead, we'll feature a discussion on the elimination of bariatric weight loss surgery coverage from the state health benefit plan. It'll mean thousands of dollars in out-of-pocket medical expenses for employees of the state considering weight loss surgery. Stay with us. Much more to come. Welcome back to Primetime Lawmakers. Tonight we're talking about the challenge of providing health care to Georgians, and specifically about the decision to eliminate coverage for bariatric surgery from the State Health Benefit Plan, or SHBP. Yesterday, the House Health and Human Services Committee heard about the benefits of bariatric surgery. Testimony came from patients that have benefited, as well as physicians and advocates.
Bariatric surgery is reserved for those who are the sickest, those who struggle with their weight the most and have health problems because of it. So when you perform surgery on them and they lose the weight, their health problems go away as well. And of course that generates cost savings. And we know from the data that it takes about 2.5 years to return all the monies that have been spent on the bariatric surgery procedure themselves. So it is a cost-saving item, and so when you cut the benefit, although it saves money now because you're not paying for surgeries that are done this year, it's going to cost the state many times that in future years.
I've done over 6,000 of these operations over the past several years, and with this particular type of operation, many of my diabetic patients, up to 90% of my diabetic patients, are off their diabetic meds totally. All right, so these are patients who, on a longer scale, would not only suffer from diabetes, but actually have complications of diabetes, and then would eventually have serious complications of diabetes. Now these patients who have a family history of diabetes, or a family history of hypertension, or a family history of heart attack or strokes, are now less likely to have those particular problems.
As you just saw, advocates are urging state lawmakers to find a way to continue to cover bariatric surgery under the State Health Benefit Plan. They point to Georgia's current health rankings. According to the Centers for Disease Control, we're 17th in obesity, 12th in diabetes, and 11th in hypertension. And in a post-surgery study completed by the Floyd Medical Center here in Georgia, those types of health concerns, often called comorbidities, were greatly reduced by bariatric surgery. For example, 42% of patients were diabetics before surgery, and 1 to 2 years after surgery, 86% of those patients no longer have diabetes. The decision was made to eliminate bariatric surgery coverage from the State Health Benefit Plan, meaning that state employees seeking the surgery would not be covered under their health insurance. And joining us now to talk about this decision and the challenges of providing health care coverage to state employees and to Georgians are David Cook, Commissioner of the Department of Community Health, which oversees the State Health Benefit Plan, and Representative Katie Dempsey, Vice Chair of the House Appropriations Committee on Human Resources. Thank you both for being with us tonight. And folks might say this is sort of a narrow subject to cover, but it sort of goes to the heart of part of the healthcare crisis that we have to decide what we're going to spend our money on. I want to draw a line here between people who won't lose weight and people who can't lose weight. We're going to talk about the folks who can't. It's a medical necessity. And Commissioner Cook, let's start with you.
Great.
Maybe
Thank
with
you.
explaining what bariatric surgery is and maybe why the state did cover it in the past.
Well, thank you, Scott. It's a pleasure to be with you tonight, too. The State Health Benefit Plan has had some serious financial challenges in this last year, and we've had to make some very tough decisions, and obviously this is one of those tough decisions. We needed to put the state plan on a solid financial footing, and if I could share this with your viewers here.
Okay.
Your viewers see this all right. Just wanted to share a few facts with you to put this issue in context. The first fact is that the State Health Benefit Plan, which covers teachers, state employees, as well as non-certificated workers, we cover about 670,000 state employees and other workers. So it's a very large plan affecting a lot of people. The second fact I'd like to point out is regarding the fiscal challenges that we had this year. We were down in April of this year to about 3 days of reserves in our state health benefit plan. A typical health plan will have 30 to 45 days. So those reserves, because of the economic challenges we've had and the appropriations funding issues, have been depleted. And then the third thing is we're facing over the next 2 years, this year and next fiscal year, 12 and 13, an $815 million deficit. Now, when we went and talked about the state health benefit plan this last year, we eliminated this $815 million deficit and reduced it to $62 million. So that was a significant reduction in expenditures for the plan, about $750 million. We did that by making some very significant structural changes. We did that by these structural changes focused on welfare. On wellness. We're very proud of the fact that we have the largest wellness plan in the country. And we did it by simplifying the administration
Well,
too, with
what's
direct bill.
these
Yep.
numbers are, we just got a couple of minutes left here. $815 million a total plan, and this bariatric coverage costs $3.5 million.
That's correct.
Is that about right? How about it, Representative Dempsey? Was it worth that money?
You know, I think we're taking time to look at this and see, you know, the effects of not doing bariatric surgery on someone that you say cannot lose the weight, that very different patient, that very different consumer, are so much more expensive later. It's a matter of paying a great deal more later when we're dealing with people with heart failure, with heart disease, with hypertension, with diabetes, which, as you said, goes away so very rapidly. The effects and the changes are quick. And joint disease, replacement of hips and knees. So the costs are steep on the onset, but they continue to come. Prescription costs, so there are all kinds of compounding factors that go into this. People miss weight. Miss work because they are overweight and because of increased health challenges. There are just so many factors to bring into it. Floyd Medical Center, that you spoke of earlier, is in my home district. So I'm very well aware of the great practice that they do there in this field. And one of the general surgeons actually who practices let me know that of all the surgeries he performs, this is without a doubt the most impacting, where he sees the greatest change and effect for his patients, and that it is such a quick recovery for that change.
Well, why particularly this one program, Commissioner Cook? Obviously, you have a lot of decisions to make. They're tough decisions to make, but why this one in particular? Why was this one excised from the program?
There are several factors that went into this. One is the fact, as we talked about, how large the state health plan is in terms of the number of people. This actually impacted about 500 people a year, which is a significant number of people, but relatively small in terms of the population this particular benefit affected. The second is that it's a relatively expensive surgery, about $20,000 or more for the surgery, and we have had this benefit in place for 3 years, so a pretty short amount of time. The typical private sector plan, only about 36% of private plans have this, only about 10% of self-funded plans like the state health benefit plan have this benefit. So when we took a look at our 3-year history, we saw no savings in this in terms of long-term savings, which 3 years is
so
not a
you
long
actually
period.
looked at the actuaries, what they came up with.
We looked at our actual experience with the with those that had the surgery, and we found that there were no savings. But I really would like to caution that it was a small number of people over a short period of time, and I think there's evidence that this can save money over the long term.
Well, let's keep an eye on that. Thank you both for joining us. Appreciate your input tonight. We've got to take a short break. Don't go anywhere. Much more to come. Our Reporter Roundtable is just ahead with Jim Galloway, the AJC's political insider, and Andy Miller, editor and CEO of Georgia Health News. We'll be right back. Welcome back to Primetime Lawmakers. This is part of the program where we go in depth with journalists and reporters. And tonight I'm joined by Jim Galloway. Jim's the political insider for the Atlanta Journal-Constitution, covering Georgia politics for 30 years. And Andy Miller, the CEO and editor of the Georgia Health News. Andy's been a healthcare journalist for 18 years. And Andy, I'll start with you. It's great to see you again.
Thanks, Scott. Thanks for having me.
It is about money, isn't it? Even we're talking about eliminating parts of the health plan here. Overall, what kind of shape is the state budget in when it comes to medical issues?
Well, I think it's a good budget year, actually. We've had several years before where we had big cuts to Medicaid and to peach care, and doctors and hospitals were kind of scrambling to prevent them. And this year, you don't have any cuts to those major programs. And in fact, there's a little bit of a raise for doctors and hospitals in the peach care program. So it's actually good from that standpoint. Plus, the governor has put in, as you know, the money for the 400 residency slots, which will help our workforce needs here in Georgia. We need a lot of doctors in this state, and we have a shortage there, and we've got money for school nurses. So I think all in all, it's pretty much a good budget. There's some problems in some smaller programs, though.
Okay.
Some federal money has been cut from a children's services program in public health, and this is something that identifies kids medical and developmental problems. With that federal loss of money, that program is going to be really hit hard.
Some other big issues today, the developments in the charter school debate. Jim, does it look like they're going to have a compromise they can vote on?
I think we've got we're very, very close to something. No vote tomorrow, but from what I understand is that we've got a written guarantee inserted in the amendment that will ensure that local school systems aren't dinged by the state when they refuse to grant a charter, and the state goes ahead and imposes one on them. That's important, and as you had lawmakers on saying that this is a real protection that rural lawmakers insisted on.
The Hope Scholarship issue certainly isn't going away, and there could be some more time bombs that go off inside that issue.
You're going the Senate Democrats are like terriers on this one, and they're going to keep grabbing this as long as they can. They had some interesting numbers that you didn't show up there. Was that they did some demographic studies of who receives the Hope Scholarships, and in particular the Zell Miller scholarships, the full ride, and of 8,700 granted in the fall of 2011. Only 320 went to African Americans. That's a vast disparity that's going to have to take. They're going to have to take a look at that.
It will be a firebrand issue. Thank you both for joining us to bring us up to speed on these things. Appreciate that. And coming up tomorrow on Lawmakers, the end of another legislative week, we'll take a look back at all the big news. Our legislative analyst will get you up to date with what's going on. Buddy Darden, former state legislator and congressman, will join us, and Chuck Clay will be here as well, the former senator, state senator. That's tomorrow on Primetime Lawmakers, immediately following the PBS NewsHour at 6:56. This broadcast repeats tomorrow morning at 5:30 if you missed any part. Coming up next is Georgia Outdoors. Sharon Collins visits the hauntingly beautiful Sapelo Island, home to the fascinating Geechee people. It's part of Georgia like no other. Have a great night.
This is a GPB original production.